Hello everyone, welcome to sqadia.com. I'm Dr. Hamna Iftikhar and today's lecture regarding gastroenterology is about the treatment of cholelithiasis, which is the gallstone disease. Many options are available for the treatment of gallstone disease, but the mainstay treatment of gallstone disease is cholecystectomy. Cholecystectomy is usually done in major parts of the world and it has gained a lot of popularity and acceptance around the world. And it is usually done in patients with complications of gallstone disease such as acute cholecystitis or acute pancreatitis or cholelithiasis. So this is an outline of the lecture that we will be discussing today. The first thing that we'll be talking about is the different types of treatment options, one being the medical therapy and the surgical therapy. So we'll be talking about that in detail. The medical therapy, one being the dissolution therapy, we'll be seeing that what are the oral drugs that can be offered to these patients. And then the second type of medical therapy is the extracorporeal shockwave lithotripsy, which is also known as the ESWL. It is usually done alongside with dissolution therapy. This causes the shrinkage and the shortening of the stones, and then ultimately dissolution therapy causes the release of the gallstones. And then we'll be talking about the different surgical options that we can offer to these patients, one being the open cholecystectomy and then the laparoscopic cholecystectomy. We'll be seeing which patients are more benefited from the open cholecystectomy and from the laparoscopic cholecystectomy. We'll be talking about the indications for treatment for complications such as acute cholecystitis. We can provide the patients with hydration, with antibiotics, and ultimately, if it's a severe condition, the patient might have cholecystectomy done. And then we will be seeing the treatment options for patients with gallstone pancreatitis, which is also one of the complications of gallstone disease. So what are the treatment options available? And then we'll be seeing patients with special problems such as patients with pregnancy having gallstone disease, patients with Mirizi syndrome. We'll be talking about Mirizi syndrome type 1 and type 2 and the different surgical options that are available for both of these types. And then we'll be seeing a few pictures of ERCP, some CT scan images, and then some MRCP images. We'll be seeing these images and explaining them in detail. And then we'll be seeing the treatment of cholelithiasis. We'll be talking about them in detail. Patients who are diagnosed pre-operatively, during the surgery, or after the surgery. And then we'll be talking about one of the complications, which is the bile duct strictures. Some patients, they do come up with a complication such as these. We'll be talking about the transhepatic cholangiography pictures and then the ERCP pictures, and we'll be pointing out the surgical clips among these pictures. And then there's a syndrome which is called as the post-cholecystectomy syndrome. These patients, they usually have symptoms of gallstone disease after having their gallbladder out. So we'll be talking in detail that why are these patients having this sort of abdominal biliary pain. They could be because of biliary, pancreatic, gastrointestinal disorders that causes this sort of abdominal pain. And then we'll be talking about the post-cholecystectomy syndromes such as the cystic duct remnants. What are the treatment options available for this sort of a remnant? And then lastly, we'll be talking about the cancer. That is also one of the complications of gallstone disease. What are these different sort of cancers, and then what are the treatment options available? Such as colorectal cancer and then biliary tract cancer. We'll be talking about that in detail. So we've got a lot of lectures on our websites, around thousands of lectures available regarding different subjects of medicine. It could be cardiology, it could be gastroenterology, surgery. So to watch these lectures, you'll have to log on to sqadia.com. You can log on today and start your free trial right away. Thank you for watching sqadia.com.